You guys, Lady Rochelle here, author and founder of Warriors Talk, where we move away from awareness towards action. This is 31 days of breast cancer awareness facts in recognition of Breast Cancer Awareness Month. And this is a special edition of Warriors Talk. And right now we are on day 18. I'm so excited about that. That means that I have given you 18 facts already as it relates, 17 as it relates to breast cancer. Today is 18, and we're going to be talking about breast cancer do's and don'ts, but you can really use them for any type of cancer. Do's and don'ts, what you should say, should not say, what you should do, should not do. Last night we did talk about when someone you love have cancer, some of the things that they will go through. And so here are some do's and don'ts when it comes to breast cancer, again, or any type of cancer. You can use these. So here we are. We're going to start with the do's first, and then we're going to move on down to the don'ts. So take clues from the person who is diagnosed with the disease. Allow them to lead. I talked about this last night in communication. Let them, if they decide to talk about, their illness, then that's up to them. If they don't, then respect their privacy. Respect the fact that they don't want to talk about it. But if they already put it out there, then okay, that's fine. But take clues from them before you just assume what they want to do. Let them know that you care. There are so many ways that you can let someone know that you care without even without even speaking a word. You can let them know that you care. Another thing that you can do is you can respect their decision. Respect their decision on how they want the cancer to be treated, even if you disagree with it. Because a lot of times, this is why people don't like to share what they're going through as it relates to cancer and what type of treatment that they're going to get. Because people will say, oh, well, my cousin did that type of treatment and, it didn't work for her, she's dead, or XYZ happened. So a lot of times people try to keep that to themselves because they don't want to hear the backlash from people, disagreeing with what they decided to do. So whatever treatment someone decides to do is totally up to them. So just respect. That's a do. Respect whatever it is that they decide, whatever decision they decide. Do include them in on different plans. If they always came to parties or whatever, y'all went to, a movie night, or y'all went for coffee every day, keep including them in on whatever plans that you normally do, and then let them tell you that they don't feel like being bothered or they don't feel good. Don't just make that decision for them and decide, oh, they have cancer, so, they may be sick or they may not feel like being bothered. No, that's not for you to decide. Allow them to decide that. It'll make them feel so much better knowing that they are still being included. And also check with them. Like if you're having something, do check with them. If you're having something at work or something, and you want to surprise them or whatever, check with them first, because they may not want people to make a big fuss, and they may mean it. So check with them first. I can remember going through my cancer journey. I did not tell my coworkers that I was going through cancer because I did not want, I didn't want sympathy, pity, none of that. I just wanted to go to work every day and do my job and go home. I didn't want to be treated a certain way. The only reason they knew I was fighting cancer is when I went out for surgery, because I had to be gone for 8 weeks. And so they was like, where's she at? So that's the only way they knew. Thank you, Deborah. I appreciate you. You already know that you are amazing with everything that you're doing with autism. I appreciate it. I really do. But I didn't tell my coworkers until I went out for surgery. And then when I was coming back from surgery, my supervisor called me. He said, hey, your coworkers want to give you like a little, party to welcome you back. Is it okay? We all want to wear pink. And I was like, okay. That's fine. But I'm glad that he checked with me and he asked me, because I was really private at work about my cancer journey. So, for him to ask me, that really meant a lot to me, because again, I didn't want people fussing over me at work. I just wanted to do my job and get paid like everybody else and go home. So the next do is expect them to have good days and bad days. Don't just expect them to be depressed all the time because they have a diagnosis, because they may not be. They may, you may see them and they may be chipper one day, the next day they may be sad, but don't just, assume that they're going to be depressed just because they're dealing with this cancer diagnosis. Know that, there will be good days, there will be bad days. Whatever days they have, just be there. Just be there for them. Because they really need it. And make sure that the relationship that you have, that you keep it normal. You're not babying them, overly helpful with them, but just make sure that it's normal as possible, so that they can feel like they're a person, and they don't feel like this is a charity case or something that you gotta treat them with baby gloves on. Don't do that. Don't do that. So compassion and patience is what you need when you're dealing with somebody with an illness. When they're fighting for their lives, they need you to really to have compassion with them for what they're going through, because it can be tiring. It can be tiring dealing with someone who has an illness that they may have chemo brain. They may be fatigued. They may not be able to eat, and you want to go out to eat. You want to go to a movie, and they're tired. Have compassion and be patient with them, and say, okay, well, when you're feeling better, then we'll go out and we'll do that. So do be patient and do have compassion with them. If you're gonna offer them help, be specific. Have some concrete ways on how you're going to help them. You know what? I'm going to help you by making you dinner tonight, or ordering DoorDash, or picking up the kids from school, or sending groceries to the house, or paying your cell phone bill, or sending a maid over to clean up so you don't have to do that. Or here you are, a spa day. Be specific about what it is that you want to contribute to their life. Don't just assume that they have everything handled. So if you're going to help them, then be specific about what it is that you want to do. All right, so that was really the good stuff, right? So we're going to get into the don'ts. And you may know some of these don'ts, because some of us probably have done some of these things, but that's okay. We learning. So there are some things that you should not be doing or not be saying when it comes to somebody who's dealing with cancer. And one of those things is, do not offer advice that they didn't ask you for. Please don't be judgmental. Please don't. Just, if you gotta bite your tongue, just do it. Don't be judgmental, because a person that's dealing with an illness such as cancer, they can probably be really sensitive, and you don't want to lose a friend for life, and you don't want them to really distant you. So if they didn't ask you for advice, then don't. Okay. So another don't is, don't feel that you must be serious all the time, because they're gonna have mood swings, they're gonna have tempers, but don't feel like you have to really deal with that, because you don't have to put up with anybody's mess, right? You don't. So if they have a temper or they have a mood swing, be like, all right, I'm gonna talk to you later. I'll talk to you later. I know this is not a good time, but don't just sit there and let somebody just dump all over you, because they feel like they can, and they feel like, oh, because I'm sick, I'm gonna do that. Don't. And don't assume that your coworker cannot do their job anymore. Don't assume that because they have cancer. Don't, because they'll be like, and that was one of my reasons why I did not want to tell the people at my job that I had cancer, because I did not want them to treat me a certain way. I was like, nope, not going to tell them. When I'm done with my treatment and I get ready to go for surgery, then I'll let them know what's happening. Now, if I could have had surgery and not told anybody, then I would have done that too. Another thing that you should not do when somebody is going through a cancer diagnosis is, don't take things personally. Because sometimes that illness, let me tell you, it can do stuff to your mind, to where sometimes you can seem like you're out of your mind. And the person that you used to dealing with, you're like, that's a totally different person. They're acting really strange. And that's because sometimes that illness can really get to you, to where, even your mind is acting funny, is tripping. Another don't is, don't be afraid to even talk about the illness. Like, some people be like tiptoeing around you because they don't even want to bring up the illness because they're afraid to bring it up. But don't be afraid to bring up the illness, and then don't feel like you have to talk about the illness all the time either. The person with the illness may want to talk about something else. So don't always, try to talk about the illness all the time. Talk about something else, because that's what they want. They want that. There you go. Don't always feel like you have to do that. And then if you used to hug this person and y'all used to, and that's the way you embrace yourself, and now since they got cancer, you act like you don't want to touch them. Cancer is not contagious. So if you used to hug that person when y'all first got together, continue to hug that person. They need a hug. I'm telling you, they do. They need a hug. And then another don't would be, don't tell the person, girl, I can imagine how you feel. Now, if you never had a cancer diagnosis, no, you don't. And even if you did have a cancer diagnosis, you are not dealing with this cancer this person is dealing with and their bodies and everything that come up, you don't know. So don't say that, girl, I can really, because you really can't. You really cannot identify with what that person is going through. Just tell them, I love you and I'm here for you. Whatever it is that you need, remember it has to be concrete. Concrete. All right, so the next don't go around someone with cancer. If you're sick, you have a fever, you got a cold, an infection, you're around them coughing, wiping your nose, sneezing, not covering no, don't do that, because if they're in treatment, if they're actively in treatment, then you can get them sick and then it could delay their treatment. It could be a break in their treatment because now they have to try to fight off this infection. And we already know that their immune system is already down. So if you know somebody that's dealing with cancer, do not go around them if you are sick. And if you're a person that's taking care of them, you should be wearing gloves and you should be wearing a mask. And you should be making sure that you're wiping your hands and you're disinfecting stuff. So just be careful. If you know someone is sick, even if they say, girl, well, just come over. I know, just come. No, when I get better, then I'm going to come around and I'm going to see you. You don't want to put them at risk and have them getting really ill and not be able to fight off that infection or that sickness that you brought them. So just don't do it. So there are some do's and don'ts when it comes to cancer. And I'm sure I did not cover them all, but this is just the basics. So just make sure that you're leading with compassion. You're leading with love when you're dealing with somebody with a cancer diagnosis. Just make sure that you allow them to take the lead when it comes to telling somebody about their cancer. Just don't assume that they can't do the normal things that they used to do unless they tell it to you. And I know sometimes we can have this pride thing to where we want to be able to function like we could, and we can't. And if you're a person that is around them all the time and you know that, then do what I said about, hiring somebody to come and clean, or taking them to their appointments, going to pick up the prescription for them. Just little things, but specific things that you can do to help lighten the load for someone who has cancer or who's fighting cancer, because trust me, it is a brutal fight. But with some love and compassion and some kindness, they can get through it. So just remember to, just be kind of sensitive to their needs, So I appreciate you guys for sticking with me for 18 days out of the 31 days that I will be doing breast cancer awareness facts in the month of October for Breast Cancer Awareness Month. We're going all the way up until October 31st. So I'm so excited that you have stuck with me, and I'm going to make sure that you walk away from Breast Cancer Awareness Month, a little heavier when it comes to the facts about breast cancer. It's not all about the pink, although I got on my warrior shirt. It's not all about the pink all the time. So I want to make sure that you walk away knowing exactly turning your awareness into action, like how to turn your awareness into action. So if you take the knowledge and you don't do anything with it, then it's not going to do anything for you. So you have to apply that knowledge and turn it into action. So thank you so much, you guys, for tuning into the 31 days of breast cancer awareness facts in recognition of Breast Cancer Awareness Month. This is day 18. Join me tomorrow, for day 19. This is author and founder of Warriors Talk, Lady Rochelle, where we are moving and changing lives one warrior at a time. Join me tomorrow. See you.